take the diagnostic tools of mental health professionals, combine them with the precision of the anesthesia community, and you get Ketamine Wellness Centers, along with thousands of people whose lives have been improved because of it. And here to tell us more is CEO Kevin Nicholson. Kevin, thanks for joining us here today.
Hey, good morning, Alex.
Nice to have you.
Thank you.
So, ketamine, let's talk about what that is and how your clinic uses it.
Sure. So ketamine's an anesthetic that's been around since, well, developed in the 60s and FDA approved in 1970. So it's been around for a long time. About 15 to 20 years ago, by chance, a organization found that ketamine in low doses, sub-anesthetic, more of a sedative level, could be very effective in treating symptoms of depression, PTSD, and other mental health disorders.
Wow, completely the opposite probably of what a lot of people think when they hear ketamine. There is a stigma certainly around it.
Right, absolutely. We've been treating patients for over 8 years, so we've been dealing with this question a lot. The ketamine does have a dissociative effect. It has a hallucinogenic property. And like any medications that's utilizes or has that kind of secondary side effect, you can, in an abuse level, get some abuse going on and so forth. It's also used in veterinary medicine to take care of animals because it doesn't impair the mammal's ability to breathe. So they use it a lot in veterinary medicine to anesthetize animals.
Of course, and that's in heavy doses. I mean, we're talking with your clinic, therapeutic levels is really what it is. And so how effective are these treatments and what specific disorders and illnesses does it treat?
So yeah, I appreciate that. The dosages are about 1/1000th the amount that we're giving compared to the abuse level, 1/100th the amount which would be administered in an anesthetic setting. So again, very low doses. The patients are mostly major depressive disorder, anxiety, PTSD, and those kind of things. We do a medical screening as well as a psychological screening on every candidate that comes into us. And then if they're cleared and medically approved by Dr. Murphy, who's our anesthesiologist, and Dr. Diamond, our clinical psychologist, then we set them up for a series of stabilization treatments.
Got it. So you have a full panel, you have heavy qualified people there who are really going to take care of the patients. And so when someone goes into the clinic, what's the process like? What can they expect when they sit down in that chair?
Well, the first thing is, they go through the screening, and once they're cleared, they can come on board. We bring them in. It's a very relaxed type setting. Each patient is placed in a private treatment room. They sit in a recliner chair. They have a trained medical professional with them 100% of the time when they're on the medication. And once the infusion starts, it's mostly just kind of a relaxing kind of little bit of a spacey feeling, but it can be very, very, very peaceful.
And that spacey feeling, it goes away after you're done with the treatment, or what's the recovery like when they're done?
Yeah, so the infusions for the mental health infusions are about an hour in length. Usually the patient's with us for about an hour and 45 minutes. The recovery time is, the patient's awake through the whole process, so they're going to be talking to us, but kind of the post-treatment kind of a little hangover per se is maybe about 45 minutes. And they're going to be able to leave and be able to go get something to eat. Legally, they cannot drive home. They do have to have an ability to have somebody take them home and drive them afterwards.
Okay, so just be prepared for that. Have someone come with you, take you home afterwards. Now let's talk about what people have said about the treatments. I mean, you guys have done how many infusions?
We're almost at 12,000 now, as a company overall in this last 7.5 years with tremendous success. Our success rates are north of 80% in the mental health community. And remember, these are patients who have mostly tried and failed all other oral antidepressants or ECT, TMS treatments and different types of modalities. So they come to us usually as the last opportunity to actually get some relief.
Right, and so the age range that people, what is the age range that?
We've treated as young as 12. We do a little different of a screening process and make sure that we're doing it safely and so forth. And we've treated as old as 88 years of age.
Wow.
And so we look at all parameters and different patients and different where they're at in their condition.
Got it. And so as far as the pain component of treating pain, is it a viable alternative to opioids, would you say?
Yeah, absolutely. It depends on the diagnosis, obviously. We can't treat all pain disorders because there's so many, but neuropathic pain like complex regional pain syndrome, fibromyalgia, different kinds of trigeminal neuralgia, those kind of things, we definitely we can help those patients. And for a lot of those patients, they're either wanting to get off of opioids or their physician is working to get them off, but they don't have really any alternative. And that's where we can really fit in.
Got it. So in the last 30 seconds we have left, if someone's listening and watching to this and they're maybe a little bit on the fence about attempting this or coming in to see you, what would you tell them?
I would say call us. You know, the best way is we have patient liaisons who will answer the phone every time you call. And spend as much time on the phone with them as you want, you know, because all of them have been through the treatment, so they really have a personal experience, but they can also quell any concerns and answer any questions. Once that's done, and if they feel confident, then they just fill out the online screening forms, and then we'll put them through the screening process, which can be done in less than a couple of days, and get them started right away.
Well, the sense I'm getting is that they'll be very well taken care of. It'll be a comfortable process throughout the whole thing, and really the effects they're going to get from it are really going to change their lives for the better. So thank you so much for coming here and telling us all about it, educating us, and nice to see you.
Thank you very much.
Absolutely. Now, Ketamine Wellness Center is located at 3130 North Swan Road, and to learn more, you can visit ketaminewellnesscenters.com or call 855-KET-WELL.